back to another AI in R5. I'm your host, Simon Chris, and joining me today is Dr. Rachna Gandhi. Rachna is the Chief Transformation Officer for Ramsay Health, and we're going to be talking about the impact that AI is having on the healthcare industry. Hey Rachna, thanks for joining AI in 5.
Hi, Simon. Pleasure. A real pleasure to be here.
Now, I'm really excited about this one. You're in the healthcare space, and there's probably a lot going on with AI around patient care and around operations and things like that. What are you seeing as some of the kind of initial low-hanging fruit use cases for AI around healthcare?
Yeah, Simon, it's a very exciting space for health. Health has traditionally been low maturity from a digital perspective, and generative AI in particular opens up a whole bunch of opportunities because it deals better with unstructured data, which we have a lot of. The interface within clinicians is far superior to other forms of technology. So I am really excited by what this can offer. I think in the short term, a lot of the usage, not necessarily value, but a lot of the use of AI in healthcare will come from AI or generative AI being embedded in solutions that we already use. So that could be things like AI embedded in electronic health records, AI embedded in procurement systems, or Copilot, for example, in Microsoft Office. I think that's where a lot of the immediate applications we can see them coming, and it is low-hanging fruit because you don't actually have to build and train models yourself. You're leveraging things that are already embedded in systems. Yep. And I'm certainly looking at that from a perspective of how you take administrative burden away from a whole bunch of use cases in health. The longer term, I think, will be a lot more profound. But in the short term, immediate things we're looking at, or I can see being applied in healthcare, is clinical documentation, for example, using AI for that to help doctors save, or even nurses save time they spend on.
You mean writing the documentation, or reviewing it, or summarizing it, or?
Well, both, really. So what we've seen here, and though clinical documentation has existed, or ambient listening or dictation has existed for a while, the quality of what we're able to produce with generative AI embedded in it is vastly superior. Yeah, so its ability to, particularly, and it's not even necessarily medically trained models. That's even better if you have a medically trained model. The ability to pick up the nuances of what's been said, help with the diagnosis, or at least help with the summarization of it, creating referral letters, creating file notes, is vastly superior to anything we've seen before. And that does take a lot of administrative work away from our clinical teams, which is a huge pain point. So we are seeing that we have certainly also started looking at more generative AI-based chatbots, which is low-hanging fruit as well, because you've had these capabilities exist, but the intelligence behind it and the accessibility behind it is more. In some ways, we are leveraging it a lot more also from a data perspective, but not so much in terms of data from a machine learning AI model, but even making data more accessible, democratizing data a bit more through generative AI interpretation of what the data models might be telling us.
And are you finding any bias for or against AI adoption? And I'm not talking about the data teams and your innovation teams and stuff, but the nurses, the doctors, the carers. Are they gravitating towards it? Are they wary of it? Do they just refuse to use it? I'm always interested about how super professionals handle something that can do a pretty good swipe at what they do.
Yes. So I'd say it's mixed, to be fair, but I would kind of overlay that with I've seen a far easier adoption of Gen AI than any other technology in health. And I think part of it is, even as I touched on before, is its clinical interface is really easy, depending on what you're using it for. And what I mean by that is AI has been around in healthcare for a long time,
Yep.
but it has really democratized the use of AI. It's made it a lot more accessible, a lot more usable. And its initial use cases, like the clinical documentation we were talking about earlier, goes to a really core pain point for clinicians, the administrative burden they carry. So I think it's had a really good start. Let me put it that way. The start's been really good because it's gone to some really core pain points. The interface is very, very intuitive.
Yep.
And in health, you do have a lot of you're operating at a high knowledge level with doctors and nurses. So the fact that it has a good, easy interface and it's going to a really key pain point, it's a big tick in
Yeah.
health.
Right.
Where you start, why I said the reaction is mixed is because I think evidence is showing that the impact of generative AI on healthcare will be a lot more profound in the longer term, where it starts to go into more clinical diagnosis, it starts to, or at least in terms of augmenting the doctor or
Yep.
supporting the doctor, goes into the space of, the amount of information available on from a medical science perspective today, it's impossible for doctors to stay across it. How do you use that as a partner in co-pilot mode?
Yep.
That starts to get a little bit more tricky when you go into those conversations because
Right.
for good reason, health is risk averse,
Yep.
and there's going to be a lot more evidence needed
And
before people are.
I'm very glad it's risk adverse. Look, we're at time, but I love to ask everybody the same question.
Yeah.
An organization or a person, just starting out on their AI journey, what advice would you have for them?
I'd say to get into it soon, not with the big complex use cases, but something small, low risk, because it's the kind of space where two things are really important in my mind. One, experimentation, because there's a lot of learning to happen here.
Yep.
It's a very exciting technology, but there's a lot to learn from
Yep.
it. And two, I'm finding because we've taken this approach is the faster you get into it, the sooner you're going to get people who are not in digital team, not in the digital or data team, feeling a lot more literate around it, feeling a lot more comfortable, feeling a lot
Yeah.
more engaged around it. So I think jump
Awesome
right
advice.
in. Yeah,
Awesome
absolutely
advice.
jump.
Look, this has been a great AI in 5. Thank you again, Rachna. We'll talk soon.
Yeah, pleasure. Thank you, Simon.